Stark. I'm on a director of the board of NAMI Santa Fe. This is our monthly NAMI Public Information Talk, which we've been doing for several years now, and we've been very grateful. We've had some absolutely fantastic speakers. Typically the talk runs from 6 to 7, and we usually stretch over a few minutes with questions. Tonight, what we're going to do is ask that you hold your questions. If you want to ask questions, you can both use the chat function on Facebook if you're watching through Facebook, or the chat function on Zoom to type in your questions, and we will relay them at the end of the talk, and hopefully we'll be able to address all of them at that time. Also want to let you know that in the chat for the Zoom call, we are putting a link to the presentation charts should you like to pull a copy of those down or be able to look at them either before or after we do the presentation is done. So that represents our introduction. And again, I hope everybody's doing well in this time, and we've all got the support we need. I would like to introduce our speaker, who is Dr. Julie Brovko. She is both a counselor and I believe psychologist in Albuquerque in private practice, but she's also affiliated with the University of New Mexico. So her talk tonight is titled The Cost of Caring, and I will now turn it over to Dr. Brovko to both introduce herself as well as move right into her talk. Dr. Brovko, thank you.
Thank you so much, Tom. I want to start out first by saying thank you to Judge Vasquez for recommending me to give this talk, and also thank you for your faith in psychological science. I also want to thank Tom and NAMI Santa Fe for inviting me to give this talk today. I really appreciate this part of my job. I was born and raised in California, but I moved to New Mexico about 10 years ago for graduate school, left for a little bit, and then came back to start a private practice. I am primarily a forensic psychologist, although I have done some clinical work, and a big piece of my work focuses on individuals with severe and persistent mental illness. So as part of my work with the university and in my private practice, one of my favorite things to do is to educate the public about various mental health issues. So I'm really grateful to be giving this presentation today. So I'm going to go ahead and share my PowerPoint with you guys. Okay. Oops. There we go. All right. So the title of my talk is called Caregiver Burden, the Cost of Caring. And I want to start out this talk by saying that, again, when I moved back to New Mexico, I was in my early 30s. Excuse me, I'm going to pull the blinds here. Okay. I was in my early 30s. I had just moved back to New Mexico. Finished my Ph.D. I was ready to start a business. I had just bought a house, and it was me and my cat, and we were ready to conquer the world. And, I thought to myself, it's finally happening. No more school. I can move on with my life. And one day, a friend of mine, we'll call him Sean, came over to the house, and we were catching up. I had just moved back to town, and he broke the news to me that he had cancer. Now, Sean was a single guy, never married, no kids, in his 60s. We knew each other through the dance community, but we had since become pretty close friends. And my response to him was, who's going with you to your doctor's appointments? There's no way that you're ever going to go alone to those. And with that conversation, my life changed forever. So, you see, I became one of Sean's primary caretakers. And for the next 2 years, I took care of him. At first I kept track of his doctor's visits, and I was the liaison between medical staff and his loved ones. Sometimes I was liaison between medical staff and Shawn. But eventually I was one of his full-time caretakers and one of the few that were there holding his hand when he took his last breath. And I'm honored, and I'll never forget the love in the room when he did pass away. And I was grateful to be a part of it and to make his last days as comfortable as possible. When people talk to me about Shawn's last years, last months, last days, they talk to me about how happy I must have been to have been with him and how lucky I was to spend time with him, especially, during the last parts of his life. I get to tell the funny stories and the happy memories about what happened at the end. But what people don't talk about is how I had finally bought a house and I didn't get to sleep in it for more than 20 days or for more than 20 nights because I was always at Shawn's house. That my new business that I was trying to start began to suffer because I couldn't be as responsive to clients. We never talked about how it was hard for me to get a second date, or that I was exhausted all the time or felt like I was gaining weight because of the lack of exercise or the crappy food that I was eating. That I didn't sleep through the night for even once for over a year, that I stopped being able to visit my own family, that my ability to be a friend tanked. We didn't talk about how sometimes I resented Shawn's illness and that I resented his doctors, and sometimes I even resented Shawn. There were times I didn't feel like helping him, and I wished he would just suck it up and stop being so needy. You see, these are the things that we don't talk about, and these are the reasons for my talk today. This is important because, as exemplified here in this quote, at one point in time, we will either be a caregiver or a patient at some point in our lives. So the topic of this talk today impacts all of us. I tell you this story for a number of reasons. This talk is not meant for me to talk at you. Being a caregiver can be so incredibly hard, and you're already suffering from that. I don't want to come in as the P.H.D. that just tells you to take a break or hire help or just get out for a while, as if I have no understanding of the exhaustion or the lack of money to pay for someone to come in and help, or the lack of understanding about how someone could possibly even help, right? Someone who doesn't know the patient, how it will take longer to explain to them what to do than to just do it yourself, or how the stress of leaving the patient with someone else can be more than the stress of not leaving the house at all. I want you to know that I get it, and I'm not here to talk at you, but I'm here to simply offer information that may hopefully help just a little bit, but if anything, for you to know that there's someone else out there that gets it. So, what is a caregiver? About 50 million Americans provide the majority of help needed by people who are elderly, ill, or disabled. And this number is expected to grow. People age 65 and over are going to double in the next 40 years, and people age 85 and older are going to more than triple. So a caregiver, this is an informal position, right? The person that's taking care of the patient did not train for this position. It's not a part of their education. They generally step up to the plate. It's an unpaid job typically, right? This is not the person's employment. It's not what they chose to do to make money. And generally there's a relationship between the person and the patient. So a spouse, a relative, a friend, a neighbor, etc. So caregivers provide a number of things. They help with a number of tasks. Some of that are activities of daily living. So they're there to help to do the things that the patient can't do, whether that's dressing or bathing, helping with personal care, attaching medical equipment, or instrumental activities, things like shopping, doing their cooking for them, managing their medications, helping with finances or housework, laundry, but they also do everything else. So sometimes they provide companionship. They laugh with the person, they cry with the person, and sometimes they're the patient's only confidant. Now, the needs of the patient really vary on the nature of the circumstances. So again, the amount that the caregiver is doing is really going to depend on what's going on with the patient. For example, for someone that has cancer, it could be they need care for months or even years. Or someone with dementia, for example, their needs are going to become increasingly higher without the likelihood of improvement. So it's really going to depend on what's going on with the individual. Somebody with severe and persistent mental illness, it's going to be a long-term thing. Because mental illness can fluctuate, there are going to be times that the individual may need more help versus less. So caregiving is not easy. Caregivers are often tired, they're unappreciated or they feel unappreciated, they're stressed, they're anxious, they feel sad, they're frustrated. Doing this job is really hard. I don't want to call anybody out here, but looking at the quotes on the screen, how many of you have felt that way, right? How much longer can I do this? It seems like there's no end in sight, where I try so hard and nothing I do ever pleases them. This is often a thankless, frustrating, stressful job. So what is caregiver burden? Basically, these are the problems, difficulties, or bad things that happen to the person that is providing care, the care to the patient. So oftentimes we refer to it as emotional or cognitive responses to caregiving. So the literature really breaks this up into two different types of burden. So the first is objective burden, and these are actual symptoms. It's burden based on actual symptoms or the behavior of the patient. And the consequences of these for the caregiver. So things like the caregiver's household activities are disrupted. They can't spend as much time with their friends. They can't spend as much time at work. Maybe their relationships with their family start to break down, or their social support goes away. It's really dependent on the number of hours that the person is spending caregiving, but in general, there's really this disruption of their personal schedule, the things that are going on in their life. And it can also lead to financial strain. Subjective burden is the psychological consequences of the illness for the caregiver. So these are things like the person's mental health starts to decline, maybe their quality of life or their well-being is decreased, or they start to feel burnt out. And it's important for you to know that this subjective burden and objective burden are really related, so that the more objective burden somebody's experiencing, the more subjective burden they're going to experience. So the literature talks about phases that the caregiver can go through. And this is really exemplified in the mental health literature. So specifically for people with severe and persistent mental illness. However, I think this is really kind of an interesting way to look at it in all different types of caregiving experiences. So before the patient is diagnosed, the caregiver feels fear, anxiety, or despair, right? What's going on with this individual? Why are they acting that way? Something's wrong. I don't know what's happening. And then the person gets their diagnosis, the patient gets their diagnosis, maybe they get on medication. And at that point, the caregiver starts to feel empathy towards the person. They're concerned about them, hope that maybe things can get better. We finally found the answer. And then it moves on to frustration and anger, right? So when the caregiver starts to realize that things are not going to get better, or things start to get worse, or when the caregiver believes that the patient isn't doing everything they can to help themselves, right? I'm doing all of this stuff. Why aren't you doing what you're supposed to be doing, right? Why am I working harder than you? Those types of feelings can cause the caregiver to feel frustrated and angry. And then phase 4 is really this sense of release or relief, when the caregiver realizes they're not going to be able to control the outcome. They're not going to be able to control what's going on. And once some of that acceptance comes in, it really can be a sense of relief for the caregiver. So research that has looked into caregiving originally focused on the economic impacts of it. So people we're really studying like what happens when somebody starts caring for another individual. Oftentimes, the caregiver can no longer keep up with work. They're having to decrease their hours. Maybe they're getting fired from their job or written up at work because, you know, they're so busy caring for the patient that they can't do what they're supposed to in terms of employment. Maybe they're having to take less hours, and because of that, they're earning lower wages. But it's really going to depend on the circumstances of the patient. Also, because caregivers in general can have difficulty maintaining their job or keeping up with their work, they oftentimes, again, can't work or get fired, and so they lack health insurance. They're not able to contribute as much to their retirement or Social Security. So this really can have some pretty immediate economic impacts, but it can also have some pretty long-term economic impacts as well. Now, also interestingly, we know from the literature that most caregivers are female. I'm not saying all, but most are, which also can impact wages. We know that in general, females make less money than males. And so that's also another really important consideration. Also important is to note that oftentimes a dual income household becomes a single income household because of this. So it's not just impacting the caregiver, but it can impact the family as well. Now, the more current research has really looked at more of the physical and psychological impacts of caregiving, and also interventions that might be helpful for the caregiver. So in terms of physical health, caregivers are under a lot of stress. Caring for another individual can be really hard. And because of that chronic stress, their immune system is more likely to break down. So they're going to get sick a lot more often. Also, because the caregiver is so busy, they're tired, you know, they're not able, there's not enough hours in the day to do everything they need to, they're not going to address their symptoms. They're not going to the doctor. They're not seeing the nurse. They're not getting the rest that they need. And as a result, caregivers aren't getting better. So they're sicker longer, or their symptoms are more intense. Caregivers are not eating or drinking the way that they should. So, you know, more likely to eat something quick, eat something fast, or maybe they're skipping meals. And as a result, an immune system is likely to suffer as well. And then the same thing with sleep. So like I said earlier, there's not enough hours in the day. You know, caregivers are so busy taking care of the patient, all their other responsibilities, oftentimes sleep suffers. Additionally, because of anxiety and depression and grief that goes along with caregiving, sleep can also be interrupted as well. So we know, again, from research that caregivers have worse subjective health, meaning they feel worse. They're just not feeling as good as they used to. Their symptoms of illness or health symptoms increase. They're taking more medications than non-caregivers, and there's actually increased hospitalizations. Psychological health is also impacted. So we know that in terms of depression, or psychological health in general, gets worse as the patient declines. So for people with severe and persistent mental illness, when someone's having, you know, a full manic episode or a psychotic episode, the caregiver's mental health is likely to get worse. In terms of, you know, people caring for the elderly or people with medical illnesses, as they start to decline, so does the psychological health of the caregiver. It can get worse when the patient's needs are unpredictable, right? You don't know what's going to happen. You don't know how the patient's going to be tomorrow or next week. That can be rough. And we know that although all kinds of psychological disorders suffer, or mental illness increases with caregivers, really the key ones that the literature talks about are depression, anxiety, and guilt. So females in general, again, are at higher risk for depression. We know that in terms of prevalence, 8.5% for females versus 4.8% for males. Also, in general, about 6.7% of the people in the United States have had a major depressive episode. So there's a lot of people that are already prone to depression. Being a caregiver makes it worse. In terms of anxiety, the numbers that I found actually seem a little small to me, but 5.7% of caregivers, they say, experience anxiety. Again, I'm not sure where that seems kind of low. I'll leave it at that. 10 to 35% of Alzheimer's caregivers experience anxiety. And then in terms of guilt, this is really stemming from the perception that, the caregiver feels like they're providing inadequate care. We know that guilt is more prevalent in younger caregivers, adult children, and employed caregivers. Again, maybe I'm not doing the best job that I can. And then also, it's more prevalent in caregivers that have more care-related interruptions in their schedule. So, you have your day planned out and then something happens with the patient and you got to switch things around. You're more likely to feel guilty. So this is problematic because psychological health can really, psychological symptoms, mental health symptoms can really reduce the quality of life. Oftentimes, caregivers are referred to as hidden patients, right? They're suffering, but nobody thinks about them. Nobody's talking about them. And as a result, caregivers have decrease in life satisfaction. Burnout and fatigue is really important to talk about. So this is basically physical, emotional, and mental exhaustion that can occur. This is due to, again, the psychological distress, the physical distress. Caregivers don't have as much social support as non-caregivers. They are known to have lower self-esteem, to have psychological problems. And really, because of all of this, caregivers sort of lose the emotional resources and feel like they don't have the energy anymore to invest in life and human relationships. The literature does talk about 3 aspects of burnout. So emotional exhaustion, depersonalization, and then low levels of personal accomplishments. So emotional exhaustion, again, is I just don't have the time and the energy and the space anymore to deal with anything because they're so busy caring for the individual. Depersonalization is sort of this negative attitude or indifferent attitude towards the patient, right? I don't even care anymore. Or, when something bad happens to them or they get bad news, it doesn't impact the caregiver in a way that maybe it impacts other people. And then in terms of the personal accomplishments, the caregiver just doesn't have the time, the energy, the space to do things that make them happy. It can also be pretty frustrating because the caregiver is really lacking some of the positive experiences that they used to have with the patient. And that can really lead to feeling like they're not accomplishing much, right? Things aren't the same between the caregiver and the patient anymore. So why does this happen to caregivers? What's going on? There's lots of reasons that the literature talks about. But some of that, and we'll go over it now, is loss of time and space. So the illness never takes a holiday, right? It never takes a break. So neither does the need for caregiving. So where does the caregiver fit into their life, all the things that have to be done for someone else? The only way to do that is for their own needs to take a backseat, not only to caregiving, but to child rearing and to working and to a bunch of other things. So caregivers sometimes don't feel like they have a choice. And if a new problem comes up, they're not going to push the patient aside. They have to put their own free time aside. So that can be really hard. Endless worry. So caregivers worry that the patient's condition is going to get worse, right? They worry about their own health. They worry that they can't continue the level of care that they, used to be able to provide when maybe they were younger. They worry that maybe someone else won't do a good job, which is not an unrealistic concern, right? What if something happens to the caregiver and somebody else takes over? Caregivers worry about finances. They, worry about where is my loved one going to go? Where's the patient going to go when I can't do this anymore? And so all of those things together can create a lot of worry, a lot of anxiety. Care and treatment goes to the patient and not the caregiver. So again, life is focused on the patient and what they need and their doctor's appointments and their symptoms and their medication. And like I said earlier, the caregiver is sort of this hidden patient that nobody's focusing on. And so they just sort of slowly and quietly can deteriorate. Caregivers feeling like they're excluded from the disease, from the treatment, the decision-making process. So they're not the patient. And oftentimes, doctors are looking for the patient to make a decision. And it is the patient's choice to make a decision about what they need. But the caregiver just sort of sits there on the sidelines and oftentimes feels like they're not included in any of that and that their needs are not being considered. So that can be really problematic. And then there's social isolation. So caregiving does nothing for your social life. There's frustration and fatigue that goes with it, which can also separate you from the company of others. I remember when I was caring for my friend, if I did go out, all I had to talk about was how tired I was or how frustrated I was or how sad or scared I was because of what I was dealing with. And there comes a point where your friends don't want to talk about that anymore. They're out having fun, and it's really hard to find some of that support from other people. Oftentimes caregivers can't hold down a job, right? So their coworkers go away. Maybe their children are grown, so they don't have support from family. Caregivers oftentimes feel like they can't leave the house. And so, they spend their entire life caring for children or parents or their spouse or their friends. They're not getting any younger. And so they start to feel really isolated and lonely. Oftentimes the caregiver, had a very close relationship with the patient, a spouse or a parent. And when the partner becomes ill, right, when the patient becomes ill, that relationship really changes. And so that's another big thing where the caregiver starts to feel like they've lost their friend, they've lost their partner, and it's very lonely. So there are some risk factors for, which individuals are more likely to experience more of this burden. So I want to start out by saying, likely at some point, all caregivers are going to experience even a piece of what I've talked about. But that may fluctuate. It depends on the patient, depends on how long the caregiving or the person has to give care. It depends on if there's help, social support, etc. But these are some of the risk factors that the literature talks about. So being female is a big one. Somebody that is less educated and living with the person that they're caring for. A person that already experiences social isolation is more likely to experience caregiver burden. Somebody with a history of mental health issues themselves, like depression. Financial difficulties can be a real big one, and as the number of hours that the person has spent caregiving. Somebody that has less coping or problem-solving skills is more likely to feel more burden. And then also lack of choice in being a caregiver. So, there are individuals that choose to step up and they know they're making that decision. There are other individuals, especially in some cultures, where it's sort of expected that, that you're going to step up and take care of your family member or take care of your friend. And when something like that happens, it can be a little bit harder for the individual. So really, the literature talks about wives and caregivers who initially had poor health, limited social interaction, and a negative outlook on the caregiving situation are the most vulnerable to feeling some of this distress. So what are some signs and symptoms? In terms of employment, so when the caregiver is leaving their jobs, they're modifying their hours at work, they have to change their job, it can be really stressful, especially, coming from a triple shift, right? You're working a job, you're doing household duties, and you're caring for the patient. In terms of family dynamics, when you start to have disagreements or conflicts with your family, violence with family members, or family members having to leave to avoid conflict with the patient, you want to start paying attention to how you're doing as a caregiver. What I mean by that is not if you're doing the job well or not well, but how are you doing internally? What's your stress level like? And then, so for physical signs and symptoms, feeling exhausted, not being able to sleep, your strength or endurance decreases, right? It's harder to pick up that box and move it across the room, or you're not able to do the same household chores that you used to. If you feel like you're getting sick more often, or that it takes longer to get better, or you feel like you're going to the doctor a lot more often, that could be a sign. Things like just not feeling good. Your head hurts, your body hurts, or other physical problems. Maybe you're gaining or losing weight. So these are all physical symptoms that could imply that maybe you're experiencing some caregiver burden. Psychological and emotional symptoms. So these include things like denying what's going on with the patient, feeling really angry or frustrated or irritable, flying off the handle, or, every conversation you have with people starts to make you mad, finding that it's hard to concentrate or hard to remember things, or just walking around feeling really sad all the time, anxious, depressed, or overwhelmed, lots of worry, or, the things that you used to find were fun are no longer of interest to you. These are all psychological signs and symptoms that something might be going on with you as a caregiver. So feeling like you haven't seen your friends in a while, that intimacy with people you care about is going away, maybe the dynamics of the family have changed. Those are all social signs to look out for. In terms of financial, having problems paying your bills or being late when you're usually not, are important things to look at. And then in terms of employment, so loss of employment or having trouble at work is also a telltale sign. And then another big one that I want to highlight is maybe starting to increase in substance use. So you're drinking more often, or you're starting to use drugs. Those are key signs that something might be going on. So caregivers feel burdened. Caregivers are stressed out. They might feel burnt out. So what, right? We all feel this way. What's the big deal? Well, besides the caregiver's own health and quality of life, which we've talked about a little bit, this can also change the relationship with the patient because it changes how you interact with them. And if, the caregiver walks around feeling frustrated or negative or not wanting to deal with the patient, it can also decrease the quality of care. So the person that you set out to take care of, it can actually suffer from this. So it is something that's really important to think about. So how do you increase resiliency? What can you do? I'm going to go over a bunch of these, but education and communication, there's community support out there. There's things that you can do for yourself. We'll talk a little bit about awareness and change as well. So for education and communication, these things are really important. Learn about your loved one's condition, what medications are helpful to them, what treatment looks like, what the side effects of their condition are and the medication, and what kind of support is out there for them in the community. So being informed about what's going on with the patient is really important. It's also really important to communicate with other individuals. So communicate with healthcare professionals, help work with them so that you can understand what your loved one's dealing with, and also to express your needs when you're helping to make medical decisions. It's also important for you to communicate with your loved one. Talk to them about their needs and talk to them about your needs. In terms of education, learning about burnout and the impact of caregiving is also an important one. So things like this talk, in terms of allowing yourself to understand what can happen and what to look for, are also really important. And then talking to other people. So whether that's the patient or the doctor or your friends or your family, just having others around you that you can talk to about what you're going through will really help. For community support, there are respite services that are out there. So respite services are things that provide a temporary break in caregiving activities to improve the well-being of the caregiver. That can look like in-home aides, so people that come to your house to provide companionship or nursing services or both to the patient. It can look like adult care centers. So these are places that you can bring your loved one, drop them off, even just for an hour or two, so you can, go out and run your errands or do whatever you need to. And then there's things like short-term nursing homes. So these are assisted living facilities where the individual goes just for short periods of time. And research has shown that these types of services have actually helped the caregiver in terms of reducing their anger towards the patient, reducing their depression, and reducing perceived burden of caring for an individual. There's also stuff out there that we're referring to, or the literature refers to, as information and computer technology support. So these are things like having a phone number that you can call if you have a question or you need somebody to listen to you. And these types of services, again, have found to reduce depression, the feeling of burden and anxiety, and have also reduced the caregiver's stress and help to increase coping skills as well. In terms of personal support, these are, again, things that you can do to help yourself. So increasing social support is key. Whether that is something formal like joining a professional organization or a club, or engaging in an extracurricular activity like softball or a knitting club or a book club, there's also informal personal support. Hang out with your friends, hang out with your family. We know from research that having frequent visitors is actually really important. So while quality time with people you care about is great, even quantity, so having somebody stop by for 5 or 10 minutes just to say hi, can also help sort of increase the social support of the caregiver. And then engaging in self-care. And that can, I like to break this up into 4 domains. So psychological, physical, spiritual, and emotional. Some of these overlap and some of them don't. It's sometimes kind of hard to break things up into categories. But in terms of psychological, so I'm going to just say it, I'm a psychologist, so I believe in therapy. I believe in counseling. Our field really can stress therapy, and I'm going to. So group therapy, individual therapy, we know can be really, really helpful. But not everybody has the time, not everyone has the resources or the energy to engage in therapy. So that's not the only thing that I'm talking about here. Talk to a friend, talk to a family member. Just try and, really connect with other people. So also decreasing personal stressors. If something is bothering you or stressing you out and you don't need to deal with it, get rid of it. Physical self-care. So these are things like going to the doctor regularly, getting checked up when you need it, eat when you should, don't skip meals, drink plenty of water, stop drinking soda, take vacations. All of these things are really going to help to increase your physical health. Now, spiritual, when I say that, I mean trying to provide some kind of meaning to life and what you're doing. So it doesn't have to be church or a temple, although it can be. But really, this means striving for things that inspire you and comfort you. So whether that's spending time in nature or sitting on the back patio for a few minutes every day, or reading an inspirational book, as long as you're doing things that bring you optimism and hope into your life, that can really help. And then in terms of emotional, so this is sort of finding ways to release how you're feeling, and do things that make you feel good. So again, is it social action? Is it spending time with people you care about? Is it getting a massage? community outreach, or is it just spending time laughing or crying, watching a happy movie or reading a sad book, but things that kind of help you to release your emotions and the things that you're dealing with. So how do we make that concrete? These are just some examples of things that I have thought about and that the literature has talked about in terms of small changes or big ones that you can take in your life. So take breaks, even if it's 5 minutes, to take a break from your caregiving duties and kind of recoup. Exercising, again, don't skip meals, try and eat healthy, make sure you sleep. If you can, go on vacation, say no. One of my favorites is making a list and accepting help from others. So one of the articles that I was reading said for caregivers to make a list of things that other people can do to help them, big or small, so that when your friend or family member or someone calls you and says, what can I do? Get your list out and pick something off of it and give it to them and accept the help from them. Trying to keep a sense of humor about things, finding a routine, all of these things and others, get creative, can help. And then there's awareness. So burnout comes and goes, okay? It fluctuates depending on a lot of things. So it's important to constantly be checking in with yourself and have other people check in with you so that you can really monitor how you're doing so you can make the necessary adjustments if something's kind of going wrong. So what is on your plate? What are you dealing with? And what's draining you? Ask yourself every day, how am I doing? At the end of every day, how would I rate my day today on a scale of 1 to 5? These things, again, constantly checking in with yourself to figure out what's going on with you. It's also important, and this is why education is important, but also checking in is important, is to figure out what your signs and symptoms are of burnout. So are you avoiding? Right? Are you avoiding the person you're supposed to be taking care of? Are you avoiding other people? Do you maybe find yourself minimizing what the patient's going through? Oh, it's not a big deal, or they're not really suffering, or I wish they would just suck it up. Are you feeling bored with your caregiving duties? Or do you feel like you're walking around just angry all the time? Or maybe you feel nothing, maybe you just feel numb or, avoidant. Maybe like you fake interest, when your patient or the doctors are talking to you, you act like you care, but you're kind of just going through the motions. Or feeling like, I wish the patient would just get over it. Or maybe you're blaming the patient, it's their fault. If they would have just tried harder, if they would do X, Y, and Z, I wouldn't have to be dealing with this. All of these signs are things to be aware of, but not all of us are going to experience all of these things. So what is specific to you? And are you able to recognize those things in yourself? And the reason that it's important to be aware and to try and do something about it is because if you don't, eventually your body's going to give up for you. Your body's going to say no for you. And you'll get to a place where you just can't do it anymore. And that doesn't help anybody. It doesn't help you and it doesn't help your patient. So I'm going to finish up the formal part of my talk with just asking you to commit to one change, right? And it can be something very small. So, here on the slides, switch from Coke to soda water, right? What's one small thing that you can do in your life right now, one small change that might increase or help your well-being? And that's all that I can ask, and that's a good place to start. With that, I will go ahead and open it up to questions. I want to thank you all for listening to me talk for 45 minutes.
Can you unshare your screen?
Yeah.
There we go. Okay. Let's see. Jessica, do we have any other questions?
Not any on Facebook so far.
Okay, I'm going to unmute everybody, and unless they're muted themselves. And if you would like to ask questions, the floor is open.
I have a question
Yes.
for you. Do you think that you used a lot of your personal experiences to kind of play in on this in such a negative way? Because I thought that, you know, it wouldn't be such a bad job when I was younger, before I'm someone with mental illness, before I ended up with some myself, that I wouldn't mind caring about other people. I just think that you might have gotten kind of wrapped up in things yourself.
So I think you bring up a really good point. Caregiving can be a beautiful, wonderful experience. And I think a lot of people are grateful. I'm grateful myself to have been able to care for my friend. The purpose of this talk was simply to highlight some of the negative impact of that, but also talk about things that the caregiver can do so that they can stay as healthy and present as possible, so that they can positive parts of caregiving.
Yeah. Thank you.
You're welcome. Anyone else have any questions or comments?
Well, if not, we thank you very much for your presentation. I thought it was some excellent information. And I think one of the things I'm taking away from it is it would be really useful if, NAMI could take a look in Santa Fe at what all the resources are that are available to support caregivers. And I'm thinking of things like the New Mexico Crisis Line has a warm line where people can just call up and chat about what they're struggling with. It doesn't have to be a crisis or anything extreme. It's just a place to call up and talk to somebody who's shared some similar experiences and is a good listener. But I think there are a lot of opportunities like that that we might want to see if we can't get written down somewhere and be able to share with people. So I thank you very much. It was an excellent presentation.
Thank you very much.
Can you hear me, Tom?
Yeah, Jess, do you have questions for Facebook?
There's one that came through in the chat. You can see from Cameron. Is there anything we can extrapolate from caregivers to paid providers?
Yes, absolutely. This is a huge topic in the paid provider literature as well. And burnout is actually, I would say there's more literature for paid providers than informal caregivers out there. And I think a lot of the I provided are helpful, but I would also say for paid providers, I think it's really important to have a lot of institutional support with the, whatever group they're working with, as well as to have colleagues that they can turn to sort of discuss what's going on. And then also part of the unique piece for paid providers is really being able to understand what our biases are in terms of maybe there are specific patients or specific cases that are harder for us to deal with or impact us more than others, and knowing what those are and then making sure that we're either referring those cases out or taking extra precautions to make sure we're handling whatever might come up from those cases.
Hi, I have another question. Well, thank you so much. This is Monica Vierge here in Taos. And I was wondering, well, thanks for the presentation. I was wondering if you could talk a little bit about the loss and grief once the caregiver the person that she or he has been taking care of for so long, what happens with that burden, right? And how does it ways of helping caregivers that they've been like burned out, they've been carrying all that burden, and then later on, there's like that person, they're like, going through a grief basically. I wonder if you can talk a little bit about it.
So are you asking me about the grief that comes along when the patient is either better or no longer with us anymore? Are you referring to kind of grief that goes along with the burden of just caregiving in general?
After, like, the grief after you've been a caregiver and you've been like kind of like feeling a lot of burned out, and that your role as a caregiver, is not there anymore. And sometimes, I'm just thinking about a couple of patients that they've been like going through a lot of kind of also like guilt and like stages and like things that we go through normal, if there's anything like normal, but like processing loss and going through grief. But I was wondering if you can if there's any specific on like caregiver burned out or burden in grief.
So I'm sure there's literature out there that talks about that specifically. I think part of it is going to be just sort of the normal grieving process, but part of that's going to be specific because the caregiver is, all of a sudden going from spending their whole life dedicated to an individual to that not being there anymore. So on one hand, the caregiver is getting a lot of time back, but with that time, they have the time to think about all the things they did right or wrong, things they could have done better or worse. And, really that huge part of their life is no longer there anymore. If I was working with an individual like that, I think a big piece would be, in addition to processing those feelings, really trying to put things back into the caregiver's life that they find meaningful and important, so that they're, feeling like their life has some structure to it again. And that can be done in a variety of ways with the help of a mental health professional, but again, really relying on the support of family and friends. And then I think a big piece of it too is the caregiver taking some time to really think about what's important to me. What do I want my life to mean? And what do I want to do with my life? And then what are some things that I can put in place to sort of accomplish those goals?
Thank you. That was helpful.
Sure.
Anyone else? Well, let us conclude this presentation with that last question and Dr. Brovko's answer. Thank you very much for spending time with us tonight. We really appreciated it. We look forward to having you be a speaker again in the future.
Thank you very much for having me.
You're welcome. And thank you all to our audience. This is the end of our information talk and our Zoom conference. Good night.
Good night.
Good night.